A dry mouth can appear even when lung tests show normal results. A noisy night can occur despite normal lung tests. Morning fatigue can still be present with normal lung test results. These symptoms can coexist with normal lung function, according to tests. Individuals might experience a dry mouth without lung issues being present. Noisy nights can happen even if lung tests are normal. Morning fatigue can persist even when lung tests are within normal range. These symptoms do not necessarily indicate abnormal lung function. Normal lung test results do not preclude the presence of these symptoms. It is important to consider multiple factors when evaluating respiratory health. Mouth breathing is not just a style choice. The body was not designed to process raw air. Air entering through the mouth stays cooler and drier, bypassing normal lung filtration. A short experiment revealed that mouth breathing quickly raised stress markers even in healthy adults. Snoring and sleep apnea episodes increased sharply, making sleep lighter and less restorative. Mouth breathing also increased water loss, intensifying thirst, dryness, and nighttime awakenings. In that experiment, blood pressure climbed into a hypertension range within days, alongside reduced heart rhythm balance. When the same people switched back to nasal breathing, blood pressure dropped and breathing symptoms eased quickly. This contrast shows that changing the breathing route can improve sleep quality and reduce cardiovascular strain. A practical first step is noticing mouth breathing during sleep and choosing steps to keep lips closed at night. Another step is practicing nasal breathing during the day, as habits during waking hours often carry into sleep. The nose is designed to warm, filter, and humidify air before it reaches the delicate tissues of the lungs. Inside the nasal passages, turbinates and mucus work together to trap particles, while cilia move debris away. This design reduces irritation and supports immune defense by ensuring that less dust and pollen reach the lower airway. The nose also produces nitric oxide, which enhances circulation and helps manage microbes in the nasal passages. Humming can increase nitric oxide release, linking nasal use to broader chemical changes beyond simple airflow. When nasal breathing is limited by swelling or a narrow passage, the entire airway can become less stable. The concept of a united airway means that problems in the nose can affect the lungs, heart, and sleep. This is why improving nasal function often changes how the whole body feels during effort and rest. A useful next step is to practice nasal breathing during calm periods to help the pathway feel normal again. Pair that practice with gentle humming and slow exhale sessions to reinforce nasal function without forcing. The breathing rate sends signals to the nervous system, particularly through changes in carbon dioxide and pressure. When breaths slow down, the body can shift toward calmer heart rhythms and steadier attention. Researchers describe an optimal breathing rate of about 5.5 breaths per minute for many people. This pace, approximately 1 breath every 10 seconds, can be trained with even inhale and exhale counts. A simple pattern is to breathe in for 5 seconds and breathe out for 5 seconds through the nose. People practicing this rhythm often report a quieter mind, and measurements show changes in heart rate variability. Unlike quick breath tricks, this method works through repetition, allowing the body to learn a calmer default. It also trains longer exhales, which reduces overbreathing and supports more stable blood chemistry. Start with 3 minutes twice daily, then gradually build toward 10 minutes while keeping the breath light and silent. If you want to improve focus and sleep with more breath pacing drills, subscribe to keep practicing with us. Carbon dioxide is not just waste. It helps regulate breathing drive and oxygen delivery in tissues. When carbon dioxide levels drop too low, hemoglobin holds onto oxygen more tightly, so less oxygen reaches working cells. This effect, known as the Bohr effect, explains why overbreathing can feel like air hunger. Symptoms of low carbon dioxide can include dizziness, tingling, and mental confusion, even with normal oxygen levels. A key principle is that breathing less can restore carbon dioxide levels and improve oxygen release where it is needed. Training methods like Buteyko aim to reduce chronic overbreathing by keeping breaths small and nasal. These practices also build tolerance for mild carbon dioxide rise, which can lower panic and improve endurance. The goal is not breath-holding contests, but steady control that matches breathing to real metabolic demand. One safe next move is to extend the exhale slightly and pause briefly after exhale while staying relaxed. Over weeks, this can reduce the urge to gulp air and make nasal breathing feel sustainable during stress. Airway problems are linked to facial structure, because the mouth and nose share limited space. Modern soft diets reduce chewing, leading to narrower jaw arches that leave less room for the tongue. When the tongue sits low or back, the airway can narrow, making mouth breathing more likely. Researchers comparing skulls across generations found more crooked teeth and altered jaw growth in recent populations. These shifts can create high or V-shaped palates, which change nasal volume and increase breathing resistance. Some people use orthodontic devices to expand the palate and improve nasal airflow over time. Chewing harder foods and training tongue posture can support better growth patterns, especially in younger ages. The broader point is that breathing mechanics are shaped by daily behaviours, not just genetics or fitness. Evaluating chewing habits, nasal patency, and tongue position as one connected system is helpful. That perspective turns airway work into long-term training rather than a short fix for one symptom. Start with better breathing by using your nose for air whenever possible and keeping your breath calm. Next, protect your sleep by reducing mouth breathing, as changes in breathing routes can quickly shift snoring and pressure. Support nasal function with humid air, gentle clearing routines, and brief humming sessions that emphasize nasal breathing. Add a daily slow breathing session, taking one breath every 10 seconds to train steadier rhythms. Reduce chronic overbreathing by favoring lighter breaths and slightly longer exhales during normal activities. Gradually build carbon dioxide tolerance to improve oxygen delivery and reduce stress reactions. Do not overlook the importance of structure. Proper chewing, tongue posture, and jaw space can significantly affect the airway for decades. Track your progress with simple markers, like quieter sleep, less dryness, and calmer recovery after stress. Small daily changes can reshape breathing patterns, as physiology responds to repetition and consistency. For more detailed explanations and guided routines, subscribe to continue building a calmer baseline.